Hey, welcome everybody. We have a great, terrific speaker, terrific program, and happy Valentine's Day, everybody. And it's very, very appropriate. Don't break your heart. It's really a pleasure to introduce Dr. Brooke Bussard. She came highly recommended from the Barnard Medical Center in Washington, D.C. They do some phenomenal things in terms of lifestyle changes to make people truly healthy. And when Dr. Bussard graduated from medical school at the University of Virginia, not too many years ago, she decided she wanted to go in a different route and not do the traditional route of physicians. And you might say, well, how compare and contrast? Interestingly, the dean of the medical school at Stanford about 2 years ago wrote an article that was published in the Wall Street Journal, which I would highly recommend that everybody look at. He points out in brutal honesty and candor that the single most important subject in medical school, frankly, in terms of making people healthy, is nutritional science. And guess how much nutritional science MDs get in medical school? The answer, none. And what he's saying is that as a result of that, doctors in the United States do not have the ability to proactively bring up this subject with patients because they don't know anything about it. And I've found that in my own work with, or not work, but as a patient myself, talking to doctors. Some of them have been very honest and say, I don't know anything about that. What I know is how to prescribe drugs. And that's really, frankly, in my perception, my opinion, what's wrong with our healthcare system. We really don't have a healthcare system. It's a hard commercial enterprise. So at any rate, Dr. Bussard, I had a chance to talk to her, look at her materials, and I'm really excited to hear her program. And I pointed out that it will be going on our YouTube page. So hopefully a substantial additional number of people will see it. And if anybody who's on the Zoom today has any questions at all, she's graciously agreed to speak up. She'd be happy to deal with that issue at the time it comes up. So Dr. Bussard, thank you very much for being here. It's great to see you.
Thanks, Gary. I really appreciate you inviting me to speak on Valentine's Day. It's such a fun way to give a talk. So happy Valentine's Day to everyone. Nobody wants a broken heart today. But in the US, every 34 seconds today, someone will die from cardiovascular disease. So I think that's over 100 deaths just in the hour that we have together. So even though a heart attack can seem like a sudden event, it actually takes decades to develop. I am going to share my slides with you. And we'll go right into the presentation. Okay, can everybody see the slides?
Yep.
Sent you all a Valentine's. Okay, so when you have a heart attack or cardiovascular disease, it's not like getting shot in the chest with an arrow. The weapon is actually the result of choices that we make at every meal, none of which seem dangerous by themselves, but the frequent exposure creates a toxic environment that leads to heart disease. And it's been said that success is the sum of a lot of small things done correctly. I'm sure you guys have heard that. But tragedy can also be the sum of a lot of small things that cause harm. So today I'd like us to focus on those small things that create success for our health. And we're going to wrap up with those at the end. My goal today is to show you the tremendous influence of lifestyle, particularly our food choices, on heart disease. And I hope to leave you with a sense of empowerment over your life and your health. Your heart is yours to break, and my hope is that you choose to mend it and protect it. So we're going to start today with a definition to be clear that we're all on the same page. We'll answer the question, what is heart disease? And after we look at that, we'll talk about what you can do about it, what you can do to prevent it or reverse it. And we'll look at how those actions can become a part of your lifestyle. So heart disease is any pathology that affects the heart. It could be structural disease that happens when you're in the womb. I'm sure you've heard of atrial septal defects. Some people just say, oh, they have a hole in their heart where the blood passes from the right side to the left side without going through the lungs and being oxygenated. You could have valvular disease where your aortic valve or your mitral valve or either of the valves on the right side have a problem and need to be replaced. It could be a problem with the electrical system like atrial fibrillation. All of these things fall under heart disease. But the most common cause, the most common form of heart disease is coronary artery disease or atherosclerosis. And this is the buildup of cholesterol in our arteries that forms plaque along the arterial walls. Classically, the symptoms that we think of are angina or chest pain. And for some people, it's like having an elephant sitting on their chest. For others, it could be a pain down their arm. Some people get a pain in their jaw. They get shortness of breath. And this, in the situation, the blood vessels that supply oxygen to the heart muscle, they get occluded and the blood flow decreases and cells start to die. But this atherosclerosis doesn't just happen in coronary vessels, the ones around the heart. The vessels around the heart are connected to all the vessels that carry blood to our entire body. So really, we should be thinking about the cardiovascular system. So when we say heart disease, really a lot of times we're referring to cardiovascular disease. So did you know that there are 60 to 100,000 miles of blood vessels in our body? That's enough times to go around the earth 3 to 4 times. I think it's about 25,000 miles around the earth. So if you pay attention to other areas in the body where arteries get smaller, more narrow, and could be occluded sooner by the process of plaque formation, sometimes you can actually hear a warning bell before you end up having a heart attack or a stroke. So let's talk about how and why we start to develop these plaques in our arteries. All right, so first we're going to, think about 2 different series of pipes in our bodies. The digestive system, which transports food from our mouth to the other end, which goes into the toilet. And the other set of pipes is going to be the cardiovascular system. Arteries, veins, and capillaries transporting blood that carry oxygen and nutrients, right? So let's think about how these 2 systems interact, because I think a lot of people don't make this connection. So when we chew our food, it travels down our esophagus, it enters our stomach, where it's broken down by enzymes and the mechanical process of churning our food. Then it goes through the pylorus into the small intestines, which is all this in the middle. And this is where most of our digestion takes place, where we absorb the nutrients from our food. So on the left, this is what the inside of the small intestines looks like. If you look at it through an endoscope, if you've had an endoscopy, they might have taken pictures and you've seen this. On the right is a schematic of what a cross-section of this wall looks like. There's just one cell layer between the surface where the food is passing through, so it would be passing through up here on top of these villi, and the area where the blood vessels are waiting. So there's just one cell layer there. So the food is passing through, it's being broken down, the proteins get broken down into amino acids, sugar molecules are available from the breakdown of carbohydrates. There's fatty acids coming from the fat in our food, along with vitamins and minerals. And once these particles pass through that lining, they're now in the blood, and these nutrients can be delivered to all the cells throughout the body. So this is not a closed system, right? Substances get into our blood supply from the foods that we eat. And if those substances are harmful, they'll damage our blood vessels while we're trying to provide the cells in our brain, our hearts, our muscles, all the areas of our body with nutrients that they need. So let's think about the copper pipes in a house. They're delivering water to all the things in a house that use water, right? And you want to get water to the sinks, the showers, the dishwasher, the laundry machine. But if there are substances in the water that damage these pipes, it can wreak some serious havoc. And you might not be able to use the shower or the laundry machine because the flow is too slow. Or heaven forbid, the pipe ruptures. This does not happen in a short period of time. It took years for this copper pipe to become corroded. And the same is true with cardiovascular disease. It takes a long time for heart disease to become symptomatic. The time frame for having a heart attack is it's more than several decades. Plaque formation doesn't often cause problems for about 40 or 50 years. So it begins with these fatty streaks starting to lay down this lipid layer, and these lipids accumulate for 30 or 40 years, and then they become fibrous plaques, complicated lesions, and these are the things that can start to rupture, and you get a blood clot, which then causes the heart attack. Well, this is not new information. It might be new to you, but it's not new information in the scientific world. Autopsy studies of soldiers and trauma victims have shown us that changes in the arteries can happen very early in life. One of the first studies to uncover this was the Korean soldier study that was published in 1953. So they did autopsies on 300 soldiers, none of whom had known heart disease. The average age of these soldiers was only 22 years, and atherosclerosis was visible to the naked eye in over 77% of the soldiers. So that's over 3/4 of these men, you could see the plaque without a microscope. And these soldiers, they were in good physical condition with a normal body weight. So a lot of times, people think, oh, I look great. There's probably nothing wrong with me. But we don't know that. We don't know what's going on the inside in the arteries of your system. So here's a more recent study. In 1999, researchers looked at the arteries of young people who died from accidents or homicides. And they saw that the prevalence of atherosclerosis in this group of adolescents and young adults who were 15 to 34 years old was profound. Every one of them had atherosclerotic lesions in their aortas, and over half already had lesions in the coronary arteries that surround their heart. So let's look at the anatomy of an artery and figure out how our food choices can alter the normal function of this blood vessel. So this is the blood vessel. The lining of this vessel is 1 cell thick, and this layer is referred to as the endothelium. These cells are so important for maintaining the health of our cardiovascular system. They're active. They release chemicals that help dilate blood vessels when more flow is needed. So we wouldn't want to do anything to impair the ability of these cells to perform their task. So we talked about how blood runs through these tubes, these pipes, right, that carry nutrients that were absorbed from the digestive tract, right? So let's try to picture this. Let's use a garden hose as an analogy. So we might find different things in our garden hose. On the left, we have water, which is running very smoothly. But on the right, oh heavens, we have a slug that has made his way into this garden hose. Now, sometimes blood flows very smoothly through our vessels, the way water flows through a hose. But some things in our blood can actually make it viscous and thick, more slug-like. So have you ever thought about the way the composition of blood could change based on what we eat? I don't think many people think about that, but what do you think happens to the blood when you eat butter compared to when you eat strawberries? Well, hopefully you're not sitting around eating butter, but let's use eggs and bacon as an example. Eggs and bacon versus a strawberry smoothie bowl. Now, it takes about 4 to 6 hours for fat to clear out of your bloodstream. So the fat that's in these foods goes into your bloodstream. And if you are repeatedly eating fatty foods, your blood is going to stay viscous from meal to meal to meal, because this fat, I'm going to show you where it shows up. It's going to show up in your plasma. So normally when you get your blood drawn, you know, and you look down and they've drawn the tube of blood, it's red all the way from top to bottom of the tube. That's whole blood. But if you let it sit for a while, it separates. And the red blood cells, which are heavier, they sink to the bottom. The white blood cells and platelets form a small layer in the middle, and then the top layer is plasma. So I don't know if any of you have seen the documentary Game Changers, but if you have, this will look familiar. So there was a scene in the documentary when the athletes ate burritos, either with black beans or chicken in them. Now, chicken has about 1/4 of its calories coming from fat, whereas black beans have about 4% of their calories coming from fat. The fat makes the plasma cloudy and more viscous. And this is what provides the materials that's used to form those plaques in your arteries. So a more extreme example, I thought I'd show you this person. They may have eaten that slab of butter. So this is a lab from a patient with very high triglycerides, which are fatty acids. At 999, that was just as high as the lab could probably read it. But you can see this blood is so cloudy, you cannot see through it at all. And when blood is cloudy like this, they refer to it as lipemic, lipid meaning fat. So lipemic serum at 4+ is very high in fat. So the fat we see in the blood is the fat that lays down along the wall of the arteries and causes the fatty streaks, which progress into these plaques. And when arteries get clogged and the blood flow slows down, a number of symptoms can develop. You might feel fatigued or dizzy. You may get shortness of breath. Low back pain is a sign of clogged arteries because the blood vessels that come off of the aorta down in the spinal area, those blood vessels are very small, very narrow. Cold hands and feet, they might be painful or numb. Again, the blood vessels get very small as you go, distally into the extremities. Strokes and mini strokes, which are known as TIAs, transient ischemic attacks, and then erectile dysfunction. These are all signs of clogged arteries. So there have been so many drugs used to treat the symptoms of heart disease, drugs for hypertension and angina, chest pain. But in 1989, the scientists at Pfizer created a new drug called sildenafil as another option for treating heart disease. And this may look familiar. While the drug was in the early trials for the treatment of heart disease, volunteers started to report increased erections. Now, why did that happen? Well, because the drugs allowed the blood vessels to dilate and get flow to areas that had been previously restricted by atherosclerosis. And the interesting side note there is that sildenafil, which was named Viagra, ended up being one of the fastest drugs to ever get FDA approval. But the point of the story is that we can get warning signs if we think about areas in our body that have more narrow blood vessels, because they're more likely to show the signs of impaired blood flow. So we can summarize heart disease as the development of atherosclerosis or plaque formation in the lining of the blood vessels. And it happens slowly over time until the plaque impairs blood flow and starts to cause symptoms which can be fatal. So the next question is, what can I do about it? Well, if you've gotten to the point where you have symptoms that prompted intervention and you've received a diagnosis of heart disease, there are certainly treatment options that have been presented. It may be a procedure like angioplasty with or without stent placement. It might be in the form of prescription drugs. But the bottom line is that you're relying on someone else or something else to fix you. And the problem is that they're only able to treat the symptoms or do damage control. They're not able to get to the root of the problem. These are just temporary measures that buy time, and they treat the numbers, but they don't actually address the underlying cause. We have to stop putting the building blocks of plaque in the vessels. We have to stop making the blood cloudy and viscous like we saw in those test tubes. So we need to take these foods out of our diet. Foods that are high in fat, especially saturated fat. So that includes animal-based foods like meats and dairy products, highly processed foods, and focus on whole plant foods that are eaten in a form close to how they exist in nature. So we need to avoid the standard American diet for sure, this Western diet, which has spread all over the globe. These foods are just very inflammatory to the lining of our blood vessels. So imagine using this type of prescription to prevent or reverse heart disease. Plant foods, low in saturated fat. You know, they don't cause our blood to be cloudy. They don't cause damage to the cells that line our vessels. Well, somebody actually did that. So I think in a few other CLA presentations, you guys have heard about Dr. Caldwell Esselstyn, but I thought I'd just highlight this study to illustrate the effects of certain foods on our blood vessels. So this study was published almost 10 years ago in 2014 in the Journal of Family Practice. And Dr. Esselstyn took 198 patients, all of whom had known heart disease, who were interested in transitioning to a plant-based diet. So they eliminated dairy, fish, meat, and added oils. And he followed them for over 3.5 years. And during that time, 89% of them were able to adhere to the diet. Only 11% were not able to adhere. And the results were quite remarkable. So they ate foods like pasta with veggies, muesli or oatmeal with fruit or smoothie bowls. Their diet was based on a plate of whole plant foods, fruits, vegetables, whole grains, and legumes, which are beans, peas, or lentils. And these are the results. So remember, 177 of the patients, 89%, followed the whole food plant-based diet. 21 did not. In the group that adhered, only one had an event during the 3.5 years of follow-up. But 13 of the 21 patients who were not able to adhere experienced adverse events. 2 had a stroke, 1 needed a heart transplant, 2 died, 4 needed angioplasty with stents, 3 had open heart surgeries, and 1 had an endarterectomy. This is an absolutely remarkable result. The people who ate the whole food plant-based diet essentially halted or reversed their heart disease. And the other group who continued to eat their normal diet suffered from the natural progression of the disease. Now, that study was actually prompted by some of Esselstyn's earlier research, which is highlighted in the documentary Forks Over Knives. I highly recommend this documentary. In 1985, he took 24 patients who had severe triple vessel disease. So the 3 main vessels in their heart were occluded, and he placed them on a plant-based diet. 5 were told that they wouldn't even live out the year by their cardiologist. But Dr. Esselstyn told them to eat plant foods, stay away from animal foods, refined sugar and oil. 18 of those 24 were able to stick to the program. They had no further cardiac events during the next 12 years on that plant-based diet. It's absolutely amazing. And I love this angiogram from one of his patients. Before the study started, this was their left anterior descending artery, which is known as the widowmaker. This is blood flow in the white area that you're seeing here is the blood vessel with blood flow coming through the artery. And you can see here, it gets really ratty. The blood can't get through because the vessel is so diseased. After 32 months of a plant-based diet and a new angiogram, the blood flow is just beautiful going through this vessel. The vessel has repaired itself. The body's ability to heal is absolutely amazing and astounding to me every time I see it. So some people think that a whole food, plant-based diet is extreme. I mean, that looks extreme, doesn't it? It looks ridiculous. Like, who would eat that, right? Right. Well, actually, I mean, this to me seems extreme, right? And this is just the staples at the end of the bypass surgery. Before this even happened, the patient was rushed to the hospital, taken back to the OR. They, did an incision through the skin. They got out the saw, the, bone saw to saw through the sternum. Then they put the retractors in and pulled the chest open and held it open for hours while they lifted the heart out and took grafts from the legs or the mammary artery or, and sewed them around the diseased vessels and then put the heart back in the chest, use wires to like put the sternum back together and then put the skin together and stapled it. Now that is extreme. Okay, so one more thing to wrap up the what can I do about it section. I think it's important that everyone know about the blue zones. The blue zones are areas of the world where people live the longest, healthiest lives. They eat primarily whole plant foods with less than 5% of their diet coming from animal products or processed foods. And they were discovered by Dan Buettner, a National Geographic explorer, and he has been studying them for decades. So he has written several amazing books about the blue zones diet, the blue zones cookbook now. A lot of good resources have come out of this research. So I highly recommend digging into that if you want to know more. So we've talked about what is heart disease, what can we do about it? But the big question for most people is, how will it change my lifestyle? If I want to try a whole food plant-based diet, what will that look like? So before we dive into that, does anybody have any questions about the science or the studies or any of that good stuff? Or do you want to know how will it change your lifestyle? Okay, we'll dive right in, because this is how it'll change your lifestyle. You can enjoy life, with your spouse, your kids, your grandkids. You can stay physically active, not being limited by chronic lifestyle diseases like heart disease. But you'll need to put in some effort. It's behavior change, right? Like anytime we need to change our behavior, there's an initial amount of effort that needs to go in. We need to break old habits, make some new ones. Eating home-cooked meals is one of the best things you can do for your health. One of the best things, but it can be fun. Some people think it's, intimidating, but it can be fun. Think of it as self-care. Put on music, put on your favorite podcast, invite friends or family members to cook and eat with you. And you can start simple. You can just start by cutting up veggies and making a dip. This is hummus. To make hummus, you use chickpeas, the juice of the chickpeas, which has a fancy, fun name called aquafaba that you can learn and tell all your friends about. Tahini, which is just ground up sesame seeds. It's sold in a jar like peanut butter. Garlic, lemon juice, chili powder, cumin, and salt. So, super simple to make. And then when you're ready to step it up, you can try my famous nacho dip. And if you're thinking there's traditional cheese in this, I would not sabotage you like that. This nacho dip is made from cashews and carrots with some nutritional yeast, and then some lemon juice, onion, garlic, marinara sauce, and then black beans and corn, really round it out and make a full meal of it with some spinach and then spices to go along. You can start making granola if you want to make your house smell amazing. This is one of my favorite things to do. And the cool thing is that you can add in whatever ingredients you like. So I love pumpkin seeds and sunflower seeds. My mother-in-law loves the shredded coconut. And then it's the oats and the maple syrup, that really form the base of a granola. So you can change it up however you want. And remembering to eat fresh fruit instead of processed foods when you want a snack. That's a super simple thing to do, but so many times people forget about it. Gary, do you have a question?
Yeah, about fruit. Sometimes my understanding is if you eat too much fruit, it can raise one's triglycerides. Do you have any thoughts about that?
Well, I think people can overdo it with fruit.
That's me.
And I think one of the problems is that every time you eat something, you're not eating something else. So, you could be eating, hummus and veggies, but for lunch, but maybe you decide that you wanted a smoothie bowl instead. But you already had a bunch of fruit at breakfast time on your oatmeal. So you're just increasing the amount of fruit that you're getting per day, but it's decreasing the amount of vegetables that you're getting in the day. So the vegetables, have a different nutrient profile. They have, a lot of fiber, and fruit has a lot of fiber, but vegetables usually have even more because the fiber is like the skeleton that makes the plant stand up. And so I think it's important to, be thoughtful about how many servings of fruits, vegetables, grains, and legumes you have in your day, and try to really equalize them all and not favor one particular food group.
Do you have any recommendations in terms of the maximum number of fruits to eat per day? Or thoughts on that?
Typically, I say 2 to 3 servings a day.
Okay.
Yeah.
Thank you. Yeah. Okay. Thank you.
You're welcome. Okay, so we don't need to give up dessert. Just means do it a little differently. This is a recipe for black bean brownies, which are absolutely delicious. This is on my website, plantsoveranimals.com, where you use black beans and maple syrup with some cocoa powder and oats. This is so good, and it's a real crowd pleaser. So when we think about plant-based nutrition, there are plenty of options for foods that promote health and protect and heal our blood vessels and our heart. So this is just a short list of ingredients to help you envision some possibilities. A lot of people think that plant-based eating is restrictive. And for me, when I went plant-based about 13 years ago, really it expanded the amount of different foods that I eat. And I would say my nutrition is, so much better than it was, when I was eating, chicken and yogurt every day. So think about how many nutrients are in all of these foods. It's incredible. They talk about, eating the rainbow, and, you can't really do that with the standard American diet. You need to eat a lot of fruits and veggies, and, vary your diet. So I'll share some ideas from meal planning that I do with my clients, just to give you, a good sense of what you would be eating if you tried to eat plant-based. So for breakfast, it might be oatmeal with apples and raisins, might be cereal with some non-dairy milk and fruit, could be smoothies or smoothie bowls, breakfast cookies, scrambled tofu and potatoes or pancakes, oatmeal bakes. I have one that I do with bananas and blueberries that's delicious. So here's some a tofu scramble, some hash browns, some fruit. This is oatmeal with apples and raisins, walnuts and cinnamon and some coconut. If you've never had overnight oats, I think these are a great breakfast, sort of a easy run out the door, make ahead meal. A lot of times in the summer, I'll make 5 overnight oats on Sunday night and just have them for each morning, Monday through Friday. And there's so many different varieties of overnight oats. If you Google that, you can find something that you like. Apple cinnamon. Somebody did a pumpkin one that was absolutely delicious. And I have done that one also. Pumpkin spice in the fall. It's so good. Whole grain blueberry pancakes, smoothie bowls. And if the grandkids are in town, make them, silly. The last 2 breakfast ideas I had, these are breakfast cookies. I make these every week at our house. People eat them breakfast, lunch, snacks, dessert. They're so good. And then, any kind of smoothie that you want. These are all good breakfast ideas. For lunch, you could have peanut butter and jelly. That's the most simple, easy thing if you're on the run. You can do salads with chickpeas or other beans, minestrone with whole wheat toast, soft tacos with black beans, rice bowls. You can put so many different foods in rice bowls. So I'll just show you a couple pictures. If you happen to go out for sushi, you can usually get a veggie sushi roll. We have a lot of good choices here in Baltimore for those. Salads that you top with chickpeas or any other bean, burritos, and then of course some fruit on the side. For dinner, I often help my clients by starting out with what they currently eat and trying to shift it to a plant-based meal, and then doing a theme for each night of the week that you can vary, or just keep it the same if you need to minimize decision making. So Monday could be red beans and rice with broccoli. Tuesday could be an Asian stir fry. Wednesday could be a pasta dish with some veggies. Thursday could be a bean burger. Friday could be a power bowl, which is really like a Buddha bowl where you really any vegetable and whole grains and beans, like they usually all go together. I haven't met any that didn't get along. Saturday, Tex-Mex bowls, tacos or burritos, and Sunday flatbread with marinara and veggies. So this happens to be a whole grain pasta with veggies and some white beans with wilted greens in there. So does this look like a good dinner for you? You think we could eat this? Your blood vessels think so. They think it looks delicious.
This is wonderful, wonderful. Do you consult clearly with people in where you live? Do you consult online with clients?
Yeah, I would say that's mostly what I do now.
Oh, great. Well,
Yeah.
golf course lessons are taught all over the world online, so why not? This would be much easier to teach online than golf courses.
Absolutely, absolutely. So we need to do some addition and some subtraction. So it's not just what you take out of your diet, like processed foods and animal products, but it's what you add into it. And I would say one of the biggest hurdles for people is just trying new foods. A lot of times people get stuck and, they're eating just sort of the same thing every day. And that's why they feel like the diet is restrictive, but it's because they haven't really been exposed to a variety of different vegetables, different grains, different beans. There's so many different beans and lentils out there that are delicious. And then people get worried about when they go out. What am I going to do when I go out with my friends? So if you're at a Japanese place or Chinese or Indian, there definitely are options. So you can make that as a suggestion of where to go. You can do veggie sushi rolls. You can do noodle dishes or soups. There's a lot of Chinese dishes that have tofu in them, broccoli and green beans. At Indian places, they usually have veggie curries that you could eat. If you go to an Italian place, you can usually find a pasta with marinara sauce that doesn't have any meat, and just tell them to hold the cheese. At pizza places, you can get marinara and veggies and don't put any cheese on top. And that's essentially what I make at home when I make flatbread on Sunday nights, and it's delicious. Mexican is usually pretty friendly for whole food plant-based eaters. You can do bean burritos, you can do veggie fajitas. I would say the toughest place to go are steakhouses, but often they have baked potatoes. Make sure they don't put any butter on it. Salads, check out whatever their sides are, their veggie sides. So you just really want to focus on the whole plant foods, and then also incorporate some nuts and seeds. So we know that nuts and seeds are very beneficial for brain health. So typically the serving size for nuts and seeds is 2 tablespoons. And it varies also depending on whether or not somebody has heart disease or diabetes or is having trouble with their weight. Because for people who are in any of those 3 categories, we have to be more strict with the amount of nuts and seeds in their diet as we're trying to pull fat out of cells or out of, blood vessels. But, if if that's not an issue, then, a little bit more nuts and seeds is okay, particularly for snacking in the afternoon. I find people enjoy nuts and seeds. But you can visit my website to get more ideas. So at plantsoveranimals.com, you can go to the recipe section. And I've got recipes to help you get started. Now, I am not a culinary artist. I'm just someone who tries to eat super healthy and share ideas to get you started. I do have a list of other websites of places where I like to get recipe ideas. I did create an app that you can get to from my website if you click on Quick Cooks. I created an app a couple years ago called Quick Cooks, and the whole premise was to make simple, super quick meals with minimal ingredients, minimal prep time for those who are just starting to learn how to cook, or people who are short on time, people who just don't want to be in the kitchen for very long. And so when you go to Quick Cooks, you choose a category. So say you choose, I guess I must have chosen entrees here. And then you choose a tool. Oh yeah, entrees. You choose a tool. So in this one, I chose toaster oven. And then you choose a recipe, whether you want to make a pizza, a stuffed sweet potato, a toaster oven quesadilla. This looks like a portobello burger. And then I clicked on stuffed sweet potato. And simply, you just take a sweet potato, bake it, then slice it open, put some black beans and corn and salsa in the middle, and it makes a very simple but complete meal. So it doesn't have to be complicated. We don't have to make this so challenging that we can't do it. So to wrap up, I'd just like to reiterate a few things. Heart disease, and more broadly, cardiovascular disease, is not an acute event. It might culminate with an acute event, but hopefully you can avoid that. It takes many years to lay the foundation for heart disease. So we can't reverse it overnight, but we can make a significant difference over time by changing our lifestyle and building new habits that protect our blood vessels from the damage of these inflammatory and fatty foods. So love your cardiovascular system, and it will love you back. So I'll leave up my contact info if anybody wants to reach out or get in touch with me, but I'll open the floor up for questions.
Any comments about alcohol?
I try not to comment about alcohol, Gary. Yeah, for some people, like it doesn't cause any issues whatsoever. For some people, they really struggle with their weight when they, consume alcohol. And for me, that's the biggest issue with my clients when I'm trying to reverse obesity or diabetes, type 2 diabetes, things that are affected by having, excess body weight. But just, alcohol in general, I don't have a whole lot to comment on about it.
Well, it is a known carcinogen. It has ethanol in it. And I mean, it seems to me I know it's customary, it's very popular, it's part of social life in, our nation, but it's probably one of the worst things you can put in your body. I
agree with you, Gary. So the World Health Organization has classifications of carcinogens for anyone who doesn't know. And group A or group 1, is it group A or group 1 carcinogens are known to cause cancer. And it's group 1, and group 2 probably cause cancer. So tobacco and, cigarettes were placed in the group 1 carcinogen list back in the 1960s. Mm-hmm. Along with asbestos, and I think hepatitis is in that group, and alcohol is in that group as well. The other thing that's in that group is that was placed there in 2015 are processed meats. So anything that's in the group 1 carcinogen list, the risk varies, but I tend to stay away from it. And if pressed, as I feel like you and I are having a pressed conversation now, I would say that I would steer away from alcohol. But it is so pervasive in our society as a part of our culture that I think, we can look at other things to improve on if that's a sticking point for somebody. I'd rather, let them, have that and deal with it at whatever point they want to. But working on things like, animal products, dairy foods, things like that, that not only affect the individual, but affect, a more global situation, I think is fruitful.
Well, thank you. Thank you.
Do we have any other questions?
Well, I have another question I could ask, and that is a difference. You touched on this. There's a difference between people who are trying to reverse chronic disease versus people who do not have that. For example, Esselstyn deals with people. I was one of his patients to reverse vascular disease. And the tragedy and the problem is so many people, as you say, it takes a long time to reach the point where you're going to have a heart attack, where it's going to kill you. So the question is, how any guidelines in terms of trying to figure out, do I have to follow a diet to reverse disease, as opposed to I'm not in that situation? It seems to me most Americans, really, the people in this listening to this we're adults. We've been eating this way since we were little kids. So we probably have significant problems in our vascular system. I mean, the study you mentioned, the Korean War, these are young adults, Americans, and the Asians at the time, if I remember correctly, who ate basically a plant-based diet, had very clear arteries. So those of us on this watching you have significant, probably vascular deposits in our arteries. So is that really, so we're really talking about not just going along, but actually maybe we need to reverse vascular disease at this time in our lives. Any thoughts about that? Oh,
I absolutely agree, Gary. I absolutely agree. I think, just because of the environment that we grew up in. I mean, if there's anyone on this call who is lucky enough to, have lived a plant-based lifestyle from the beginning, I mean, let us know how you're doing. But yeah, I mean, I reversed my own hypertension, and, I was a medical student with, 2 episodes of a hypertensive crisis in my 20s. It was ridiculous. So I know that my blood vessels were not in good shape. And, I hope that the past 13 years, they've been getting better and better and better. And I know that they have, because I haven't had any more hypertensive crises, and my blood pressure has come down significantly. So I think, not only heart disease, but I mean, type 2 diabetes is so prevalent. And the way that Americans eat, we fill our cells with fat, just because we, generally eat a very high fat diet, and that fat has to go somewhere. And when the fat gets into the cells of our muscles, eventually it ends up creating insulin resistance, where the insulin can't bind to the cell's receptor anymore because the fat is clogging it up like gum in a lock. And then we can't let glucose in, and the glucose rises in our blood, and people think, oh, I need to eat a low carb diet. And, I always think a good reaction to that is, well, you used to be able to eat a low carb diet. So it's not that you became intolerant to carbs. It's that something's going on a cellular level that's blocking that ability to deal with the carbs. And it's fat that's inside the cells. So it's interesting, when you eat the same diet that helps reverse heart disease, like Esselstyn did with his patients, you also end up reversing type 2 diabetes. And I mean, that's the coolest thing to me, is that it's the same treatment for so many of these chronic diseases.
Well, you mentioned eating a few nuts and seeds, and Esselton says he doesn't know anybody who eats a few nuts or seeds. And
Yeah.
so if you want to reverse heart disease, he says no nuts, no seeds. Any comment about that?
Well, yeah, I think so. There's got to be a trade-off. And I think for the patients that he was using in the study, and, you know, I know that, like, that is his mentality. He's thinking, okay, we want these people to live as long as possible from a cardiovascular standpoint. He's thinking about, you know, blood vessels, and keeping them as clean and healthy as possible. On the flip side, we've got Dean and Aisha Sherzai. Do you know the Sherzais?
Yeah.
Who are, you know, doing all this great research on dementia. And, you know, they've shown, their new book that came out last year, I think it was, the 30-day Alzheimer's solution. They list in there the 9 foods or food groups that really help to maintain, you know, sharp cognition, memory, focus, all that, brain related health. And nuts and seeds, they each have their own category in the 9. That's how important they think they are. So, and they are very research based, and, you know, have scoured, you know, all of the studies that have been done in the past. So I think that, you know, having nuts and seeds in our diet it probably is essential for our brain health.
Great point.
Yeah.
And Esselton does say once you reverse the heart disease, and it's really a paper tiger. It's not that difficult. It's okay to go on and eat nuts and seeds. You just want to be careful. Don't get them if they've have oil on them and salt. Stay away from those. Those are irresistible. Just don't eat those. Just the real.
Gary, that's a great point, Gary, because that's when people, they just start to, you know, shovel it in, you know,
right.
becomes the entire bag. So what I usually tell people is, you know, take, you know, 5 walnuts and crumble them up on top of your oatmeal in the morning.
There you go.
Or take a tablespoon of sunflower seeds and sprinkle them on your salad.
There you go.
Yeah.
Okay. I'd like to jump in because we've got some great questions coming in from some of our audience members. So first, Dr. Bussard, is there any connection between plaque on your teeth and cardiovascular disease?
Good question.
Not that I'm familiar with, but I don't know much about dentition. Yeah, but that's a very interesting question.
All right. So the next question is, this audience member has heard that females have a different experience of symptoms when having heart attacks. Can you discuss the differences in those symptoms for females?
Yeah, for females, the symptoms are usually not the classic elephant sitting on your chest. I would say they're more likely to have symptoms that they don't recognize as having a heart attack. So maybe it's shortness of breath. Maybe it's, you know, a pain in their arm, or, you know, something that they presume is reflux, you know, something like that. So it's important to, you know, really try to stay, you know, vigilant about making sure that you don't have an issue, not just blowing off a symptom because it's not classic.
Thank you. And regarding plant-based eating, can that help reverse cancers?
So plant-based eating is helpful for certain types of cancers. And I'll say certain types so far that we know of. So we certainly know that the reproductive cancers are helped by a plant-based diet. And that would be breast cancer, prostate cancer, ovarian cancer, anything that would be sensitive to hormones. So when you eat a plant-based diet, you take dairy out of your diet. Dairy from cow's milk has estrogen in it because it's a pregnant cow who either she's pregnant now or has just given birth and got reimpregnated, and they're milking her to get the milk. And so there's a lot of estrogen in a mammal's body when they're pregnant or they've just given birth, and that estrogen gets into the milk and then it's consumed by the humans who consume the dairy products, and it actually increases the risk for those reproductive cancers. We also know there is a clear link between animal flesh, particularly in the processed meats, and colon cancer, colorectal cancer. So those are definitely linked, and there are probably others out there too.
And the last question that I see so far, so I guess consider this a final call for those still online with us to submit any questions you have. This question is, do you recommend any plant-based supplements? For example, raw powdered organic turmeric has been recommended to me for assisting my vascular system.
So the only supplement that I recommend is B12, and that's actually been recommended actually for most adults over the age of 50, just because the B12 in our soil has been depleted. But B12 is a vitamin that's made by bacteria, and it's also made not only by bacteria in soil, but bacteria in the colon of mammals, whether it's a cow or a pig or a human. So we just don't know if we're making enough B12, and so it's always safe just to take supplemental B12. Vitamin D, which is actually a hormone, it's hard to get from food, particularly if the food isn't fortified with vitamin D. So that's another good thing to supplement with. But you could ask your doctor to draw your vitamin D level and find out what your level is to see if you need to supplement. Because for those of you in California, you might get enough sun. And if you're in Southern California particularly, and you might not need to supplement. But vitamin D is important for calcium absorption and a lot of other processes in our body. So that's a good one to have. But other than that, I don't recommend any plant-based supplements like turmeric or anything like that, just because I, try to get people to consume all their vitamins and minerals and herbs and spices in their whole food plant-based meals. I think that's the safest way to do it. We've seen supplements over time that people have taken, and we thought it was going to have a great effect, like vitamin E, and then it turned out it was terrible to supplement with vitamin E. So they, said stop doing that. So I think it's risky to try to isolate certain ingredients and put them in a pill and hope for the best. I think it's better just to eat things, in their whole plant form.
Dr. Bussard, this program that you presented was absolutely outstanding, fabulous. Thank you very, very much.
Thank you.
And anybody who gets a chance to hear you, see you on they haven't done it today, on our YouTube page, will be very, very fortunate. So thank you again for being here. It was absolutely wonderful. And thank Dr. Barnard for all the great work he's doing. He does a phenomenal job, and thank you very much.
Oh, you're welcome, Gary. Thank you guys so much. Okay. All right. Be well and happy Valentine's Day.
Thanks very much.
You're welcome.